The next award for the evening is the Qimpro Gold Standard for Healthcare. This award was instituted in 2009. Ladies and gentlemen, please join me in congratulating Dr. Sunil Kaul, our ninth Qimpro Gold Standard for Healthcare. Dr. Kaul, please come on stage.
Dr. Sunil Kaul is the founder trustee, the ANT. Yes, you heard correctly, ANT. It's an NGO based in Assam. The ANT works directly for village development in Chirang district of Bodoland. At another level, the ANT engages with other NGOs to grow the voluntary sector in the northeastern region. In 1983, Dr. Kaul joined the Army Medical Corps. For 10 years, he treated bullet and grenade injuries boldly. But he was haunted by the underbelly of rural areas in Arunachal Pradesh and Rajasthan. At this young age, he battled an emotional tsunami. His stress was traceable to his education at the Armed Forces Medical College. He had learned that poor health indicators are just the symptoms of an underlying national disease caused by myriad determinants of health, such as scarce health care and education, as well as poverty, corruption, and poor governance. He responded to his calling by taking leave to work in the rural areas of Rajasthan. Subsequently, he and a few colleagues from an NGO in Rajasthan moved to the northeast in the thick of militancy. Dr. Kaul's mission was to improve health and development with community involvement at a very low cost. Here, Dr. Kaul experienced the terror seeded by Ulfa militants, in particular, the kidnapping of a senior colleague, subsequent ransom calls, and finally, murder. Heartbroken, Dr. Kaul escaped. But this extraordinary human came back to Assam in 2000. He was armed, this time, with his wife, Jennifer Liang, a trained social worker. He founded the ANT that is located in rural areas of Chirang district, where they live and work to date. Dr. Kaul and his colleagues have trained hundreds of community health workers in Rajasthan, Assam, Meghalaya, and Manipur. They advise on health matters as well as diagnose and treat common illnesses from a box of low-cost generic medicines. He has also trained barefoot microscopists to diagnose malaria. WHO consultants have personally verified a system that delivers 95% correct species identification with rural metric pass adults. A breakthrough. Chirang has the distinction of having eliminated malaria-related mortality. Dr. Kaul and his associates in ANT's mental health program treat more than 1,200 patients a month for mental health disorders and epilepsy, and they charge less than 10 rupees a day, inclusive of medicines and periodic consultation. Dr. Kaul believes in quality of care coupled with affordability. And now let me tell you more about the ANT. The ANT celebrates the fact that size is not everything. And quite like ants, one can be small, but hardworking and effective. It believes that like ants, one can overcome great obstacles if one just perseveres united. We congratulate Dr. Sunil Kaul, our Qimpro Gold Standard 2018 for healthcare.
May I request Dr. Ashok Agarwal and Dr. Armida Fernandez, our Qimpro Platinum Standard 2013, to do the honors. Thank you. Dr. Kaul, a few words, please.
Good evening to everyone. I think I must start with thanking Qimpro Foundation for having excavated people like me out from a small place really in Assam and Northeast where very few people know about it. And I'm really honored to join a whole bunch of people, and I wonder if I'm going to be reducing their standard by being around with them, because many of them, I mean, when I read about, have done such fantastic work at such huge scales that I really find myself humbled and I really feel like an ant. But jokes apart, I think why we called ourselves the ant was that many of you also, I think, here may not know that 25% of the weight of all animals in the world, in the kingdom of animals, belongs to the ants. They're there, they are below us, and they survive despite all that. And possibly, I think they feed off all the rubbish that we throw, and they thrive. And so has been our organization. I think I must thank all my colleagues who have tolerated me. I think because, as Mr. Lula said, you know, quality comes, I mean, at one time you were talking about customers and then, you know, with the employees. But I can tell you that colleagues can be really frightened with somebody who's trying to drive quality, especially when the customers or clients don't even know what quality means, and they can do with whatever little comes their way. So we've been working with various kinds of patients, but I'm, as a public health professional, I don't think I have restricted myself to only seeing disease. I think we've worked on determinants of disease as and when people tell us that, you know, we need to intervene, and if we have the gumption to do it, or we think that we can do it well enough, it's thence that we have done many things. The weavers that we work with today, I think within a few years we're exporting stuff, because right from day one we believed that they can do it, and we made them believe that they can deliver quality, and they have been sustaining for the last 18 years now, 16 years, yeah, 16 years, and this is also an economically sustainable organization. The mental health that Roger just mentioned has also become an economically viable practice, where even the rentals of the building and the money to the psychiatrist and others who join me in treating these patients, that also is paid for, and still at 10 rupees a month. And we try and dissuade people from coming over and continuing the medication. The moment they are stabilized, we try and tell them that the same medication, probably will tell you the name and it can be available somewhere close by, because very close to 50% of the patients who come to us for mental illness or for epilepsy have to continue medication for life. And that's a daunting thing. And we hope that Ayushman, the scheme, will probably take that over, because mental health, I think even in our dreams of our healthcare professionals, we won't be able to achieve it unless we try and do something about the way we are doing it at scale, at very low cost. We work with good about 20,000 children from government schools, because I really believe that education, and it's just not me believing in it, it's because as a public health professional, I know that studies have proved it, that the single biggest factor which affects infant mortality rate is whether the mother has passed middle school or not. More than anything else, the availability of doctors, the availability of healthcare, anything, the single biggest factor is whether the mother had crossed 8. And we all know the kind of quality in education which is so pathetic in the government schools, but that's what most of our children can afford. So we're working there. More than that, I think we are happy working with communities to obliterate the differences in caste, community, religion that we keep bringing about, and I'm sorry to say it seems to be increasing. We try and work with children right from childhood through a beautiful game called Ultimate Frisbee, which we're trying to make it as most ultimate Frisbee, which can energize children into breaking these barriers. The ultimate Frisbee used to be only where there used to be 50-50. I mean, every team had to compete with an equal number of girls and boys, but we've taken it further, and we try and have all the teams who participate in our tournament have to have at least 3 languages and 3 religions in their team, so that these people can remain friendly with each other later on in life. Last but not the least, I think I must say thank you to the Qimpro Foundation and the family and sponsors for getting me up here. I'm really honored to be around. Thank you so much.